Hey, Dr. Natola here from Vitality Soft Tissue and Spine. And one question we get a lot with people with lower back pain is commenting on how tight their hamstrings are, always asking why their hamstrings are so tight. And so typically they've been told that it's because they're not flexible, they're not stretching enough, when most of the time, by the time they come and see us, they've been stretching nonstop for years or even months with no improvement in the area. So we're going to go over some 3 common causes of why hamstrings are tight when they have nothing to do with not stretching enough. So tightness is a protective response due to an injured area or something that's overloaded. Same thing with weakness. We call this protective tension or protective weakness. So one of the main areas, and the most common area we see why people's hamstrings are always tight, is one, there's a sciatic nerve entrapment or adhesion around the sciatic nerve in the hamstrings, or there's actually adhesion in the hamstring itself. And so what that does is the nerve can't move freely through the tissues, and so when it needs to slide through, when you're trying to be flexible or engage it during athletics, it is irritating the nerve. So the body will naturally respond to that nerve is being injured, it's being pulled on, it's being tensioned, and it will tighten around the area, protect the nerve from further injury, as well as the hamstring. Well, unfortunately, over time, that makes the hamstring tighter and less flexible, which is bad because you lose range of motion, and it also makes the hamstring weaker, so it's not engaging like it should, especially with somebody that needs to do that as an athlete. The second one, what we see a lot, is a disc injury in the lower back. So when the disc is inflamed or injured, the body will do anything it can to unload it and make sure it doesn't to prevent further injury and doesn't get worse. And so the hamstrings will become tight a lot, or the glutes will become tight a lot, because it's trying to protect that and engage you and keep you in a better posture, which unloads the disc from further injury as well. So that's another common area. The other common area that we see is through the adductors, or like the groin muscle area, especially what they call the adductor magnus. Now this muscle is really huge, and this allows you to do any type of hip flexion. So anytime you're walking up and down the stairs, you're running, you're basically bringing the knee up. This is engaging in that mechanism. Now, this is such a large muscle and it does so many different movements. When it has adhesion in it and it starts losing its range of motion and function, it'll overload the hamstring, and the hamstring will shut down early and try to protect that area along with the poor adductor. So you'll lose range of motion, you'll build tightness and protective tension around it. So those are the 3 most common areas. Now there's other areas that we've seen this before as well, such as hamstring tendinopathy, etc. But these are the most common areas: the adhesion in the sciatic nerve, a disc injury and adhesion in the low back, which makes the hamstrings have to engage more to keep you upright and unload the disc, as well as in the adductor muscles or the groin muscles that help engage with a lot of activities such as squatting, running, jumping, walking up the stairs, etc. So you're using it all the time. So those are the most common areas that we see in those things. So if you have chronically tight hamstrings, if you had low back pain, if you've been stretching up a storm, if you've been doing all this other exercises and it's not getting better, you need an accurate diagnosis to diagnose these problems and the right treatments to remove adhesion to get you on your way. So if you have these things for longer than 6 months, you've seen other providers and it's just not helping, give us a call, schedule a consultation, let us give you the answers that you're looking for to get you on the road to better health and lasting pain relief.